Okay, so I'm just doing a quick update on what side effects I'm currently experiencing now. All of my other pain that I had with the radiation experiences with the bowel movements and constipation, constant numbing of pain, all of that's gone away. I'm only taking paracetamol and ibuprofen at night before I go to bed, just 500 milligrams of paracetamol, and I'm taking 400 milligrams of ibuprofen, and that's all I'm needing. I'm not taking anything during the day. With this Folfox infusion, which is a take-home, I had this inserted on Monday, December 2nd, 2024. They just had the pick put in earlier, a week earlier, but they just replaced it all, cleaned it out, flushed it, put some IV bags in me for about 3 hours. I was there. I had the glucose and the what was it? Oxaliplatin drug that goes in, and then they inserted a couple of syringes of the chemo. When they put that in, she had to go very slow. I just felt some like a hot flash at first, and a metallic taste in my mouth, and then just a kind of a cold breathing sensation in my chest. So that was quite odd. And then on Monday night, my appetite was fine. Had some insomnia that night. I couldn't get any sleep at all. That is the result of the oxaliplatin, whatever. The next day, because this is in here for 48 hours, and she's coming to remove this today at the house, and which is quite convenient here in New Zealand. It's a nice service. And then I go back every other week and do the same thing for 6 rounds. And what they're referring to this last part is just kind of mopping things up and finishing the job. And hopefully we'll be able to prevent the need for surgery, which is what, you know, the goal. So yesterday I didn't have much of an appetite. I did go to work, but I didn't have much of an appetite all day. I think I'm going to probably end up getting constipation. They are giving me a nausea pill, Dexamethasone, I think that's how you say that. And so I take 2 of those in the morning with breakfast, and I still feel slightly, not a lot, but just slightly nauseous. No appetite at all. Very, very thirsty. Drinking lots of water. 3 of these a day. This is 750 mils, 3 a day. I'm very, very good at that. I drink it with lemon water. Or sometimes I put a green tea bag in there, which is also a nice change, or a splash of cranberry juice, just kind of changing up the water content. But definitely get my fluids in because I'm very thirsty all day. And then last night for dinner, I had very little, but I'm going to try harder today. But I ended up having a bowl of fruit and just strawberries and kiwi fruit, half a banana, and a little bit of yogurt in there. And then I put some frozen blueberries in there. Big mistake. They said that cold or hot can have a reaction with the drug that they put in the first day of the oxide one. They described to me what would happen, and it did. My lips got really numb quickly, and then went to the back of my throat, and I felt like I had to catch my breath. It was, but because they prepared me, I didn't panic, and they just told me to cup my hands over my mouth and breathe and try to get the heat back in, and it took about 5 minutes before I felt well. So don't do that. Just stay away from cold or hot, and just eat everything at room temperature. They're very thorough with me about you know, what to expect, and they give me a lot of documents, so if you're in this situation, you'll be well informed. If not, you know, the information's out there. So, yeah, that's just my update. At the end of the week, I'll update you again. They said that there might be some lagging side effects. I did wake up with headache yesterday, but not today, but really bad headache all day yesterday. And I just drank water and tried not to take anything for it because these drugs are really hard on your liver. And having my blood work done every week, I keep a good eye on that. As I said before, I request copies, so I watch it. My liver counts have come down. If you saw my first video, it's back down to normal again. I expect it to go back up with the Folfox drug. That's what the drug does. It's really hard for the body to process. So putting any more drugs in your body is just something you might want to avoid. Definitely avoid alcohol if you drink alcohol. I don't drink. I mean, I drink if I want to, but I choose not to drink, especially during this this time in my life where I'm focusing on my health. But yeah, no alcohol at all during the infusion for the next 6 weeks, not even a drop. So if you are somebody who enjoys a glass of wine every once in a while, just have some kombucha. That's really nice, and it does the relaxing kind of placebo effect if you had a long day at work or stressful day. So I would recommend doing that instead. Pour it in a wine glass, put a splash of cranberry juice in there, make it feel like a real drink. But you know, sip on that and enjoy that drink instead, and you will feel calmer and better, and it's better for your health anyway. So yep, that's my update. I will update again at the if I feel any more symptoms this week. Otherwise, every other week when I get the new infusion and you know, counting down to 6. I think my last one is February 10th. We'll see how I feel, but right now I'm feeling really good. The only thing that I am complaining about is my bowel movements still have a lot of burning sensation, and in my other videos I just can't stress enough how important it is to me to have a bidet. And in America you have those attachments that are very cheap. You can attach it yourself. I attached one for my brother's house in like less than 10-20 minutes. It's very, very easy. Here in New Zealand, you have to buy the seat. So about $150, not that bad again. And that takes more like, an hour to install if you need parts, just time-wise. But easy to install anyway. So, and really, really helpful when you have that, because the burning sensation is a bit unbearable. So if you don't have that, you can't afford that, then just get a squirt bottle, and that will help. And then always have on hand your mineral oil. I also mentioned that in my first videos on self-care. I'm still doing my soak baths, my milk soak baths. So I recommend, if you do have the diagnosis of any type of bowel, rectal, or the pelvic treatments, that you do the bath soaks at least once a day for 20 minutes. I'm still doing twice a day, and that really helps. So that's it. I will come back later with an update, and I hope this is helping somebody out there, but I just really want to document this and have it on record for my kids. This is the main aim. I have brothers and sisters that should be doing prostate checks. My brother already had his. My younger brother should do his soon. My other 2 sisters, I'm recommending that you do that. This is hereditary, and all of this development of cancer from the polyps that we have, they can be removed, and you can avoid this altogether and not take the risk of fighting for it. So that's all I've got to say. If it's in your family, go get a prostate check and start on prevention first. Have a good day.